like she was sick and then her operation can't be done in Mauritius. I started looking for hospital everywhere. Some suggest me Italy, some suggest me Germany, some friends suggest me India. But for me, it was very important to see how it's look and then how it will be, all the information before choosing a hospital. And I preferred first India because we have many patients from Mauritius who come to India because this operation is not done in Mauritius. Well, we have to decide to go somewhere. Finally, I decided to come to India, and then I saw Artemis.
When we had the biopsy done, then we discovered that she needed a transplant. We don't do that in Mauritius. In Mauritius, there is no such place where we can have a transplant. So, abroad is a better choice. We have to go abroad. Then Dr. Jagesa, he suggested India. Why we don't come to India? Then we search for hospitals and we find Artemis Hospital. We checked in the internet.
We meet Dr. Ramdip the same day we arrived to India, and we brought all the details from Mauritius, all the papers. He saw all the papers. He asked us lots of questions. Some was difficult for me, but I tried to answer all the questions. And my wife, who was a donor, was together with me. She also answered some questions. She knows more than me because she's all the time with the baby in the hospital in Mauritius and everywhere. And the Dr. Ramdip said we have to admit the same day to start with all the tests that have to be done. And she was admitted the same day, around in the afternoon. And she was in the ICU, and she started doing the test the same day, because her belly was a bit big, and she was snoring. She was not normal. She was not breathing well.
Tanushree was 8 years of age, but when she came in, she was 22 kilos. She was completely swollen up. The tummy was bloated. Her feet, her legs, her thighs were all filled with extra fluid. And the moment I saw her, I had to admit her to the paediatric ICU, and she was admitted for the next 3-4 days. We put in a little pipe under local anesthesia, and we took out some fluid every day, and we gave him some injections. And over the next 3-4 days, the extra fluid in her body came down. When she came to us, she was 22 kilos, and once we had taken out those extra fluid, she was 17 kilos. So she had 5 liters of extra fluid in her body, which was taken out.
I couldn't see my daughter immediately. I saw Dr. Ramdip came outside the ICU room, and I asked him if I can see my daughter once. And then he said, yes, you can go, but from outside. I saw her, I saw all the doctors surrounding her, I saw only her face, and I returned. I returned outside, and then I went to see my wife. She was conscious after the time.
When I woke up, first thing I wanted to know how Tanushree is. And the nurses tell me she's okay, and the operation went well and all. And then I wanted to see her, but I couldn't move. I was feeling a little bit pain, and my legs all were weak. So I wanted to see her. Then I had the feeling I wanted to sleep, and I was feeling very weak.
So we went ahead with the transplant, and the transplant went quite smoothly.
I saw Dr. Ramdip coming out of the operation room, and I asked him, everything is okay? He said, everything is perfect.
I think it was relatively smooth sailing after that. A lot of work in liver transplant is done by the other people involved in taking care, the intensivist, the anesthetist, the hepatologist, the pediatricians. They chipped in. There were some things about which we had to have discussions every day on the rounds, and we would have a sort of a meeting and take a decision about the way forward.
We could manage the case very well, and patient went out of operation theatre to ICU, came out very well on the next day, extubated. She was doing very well.
Tanushree, in fact, was quite a quiet child, and we really didn't have much of a problem. She seemed very calm. Once the tubes were out, a parent would generally be with her inside the room, and she worked herself well through her recovery.
The most important person to us is not the recipient, not the surgeon, but the donor. The donor usually comes awake from the operation theatre, but by next day when they're a little more relaxed, the first person they start asking to us about is the recipient. Same thing happened with Tanushree. Her mother being the donor, the first thing she wanted to know was how her daughter was doing. Tanushree's mother was a perfect patient, didn't have any issues.
So she did it quite well, and I'm happy to see that she's doing well, and we are now waiting for Tanushree to go back home.
Now that we are planning to go back, first of all, they will be very happy to see her.
I'm very, very thankful to Artemis Hospital.
आर्टेमिस हॉस्पिटल का हम धन्यवाद करते हैं जो इतनी जल्दी उन्होंने हमारी माँ को ठीक किया।